Rod went in, so you've got loads of like lumpy bits where they didn't smooth it out.
The scars of a lunchtime liposuction gone wrong. Kelly Dean thought she'd chosen an experienced surgeon in a reputable private clinic.
This is the dip where they've gone in and they've taken too much out of that area.
But the Italian surgeon had flown in for the day, carried out a series of cosmetic procedures, then returned home. He can't be traced, and Kelly has been left £4,000 out of pocket.
I just remember the pain. I'm thinking at that time, oh my God, what have I done? And I kept telling him, I'm in pain, you're hurting me. And I was crying, really, really crying. And I couldn't walk afterwards. I had to walk from Harley Street to Victoria Station, crying my eyes out. I was sick. Well, my partner had to literally almost carry me.
British doctors are increasingly concerned about the seagull surgeons who make flying visits to British clinics. There are no official figures, but it's been estimated that hundreds of cosmetic operations every year are carried out by surgeons normally based abroad. This Leeds expert warns some of the fly-in, fly-out surgeons don't provide any aftercare.
That's the time then the patients suffer. They have no setup to go into. Ideally, the hospital should be able to take any problems immediately after the operation or days to come at any time of the day. And that's the time that they don't get into the hospital, they're not able to see the same surgeon, and then the NHS ends up picking up the pieces and deal with those problems.
The cosmetic industry says foreign surgeons are properly regulated by the medical authorities, but the British Association of Aesthetic Plastic Surgeons says tougher checks are needed and they must have insurance.
They may be working here for a very small amount of time, and perhaps it's not cost effective for them to do so, but I think for the protection of the patient, who should always come first, it's imperative that they have insurance of a level that allows them to work here and that explicitly states that they can work in the United Kingdom.
Kelly thought she was in safe hands and tries not to blame herself.
To them, it's just money and you're just a number. They don't really care about it. As soon as they take your money, that's it, it's bye-bye.
Kelly hopes to have corrective surgery. The Department of Health said it will bring in new rules for the cosmetic industry later this year, so patients in future are better protected. Thomas Moore, Sky News.